Welcome all. Let's discuss on root canal irrigants today. The prime objective of root canal treatment is to eliminate pathogenic microorganisms from the infected root canal and to prevent reinfection. Now, how that is possible? It's by biomechanical preparation, that is, cleaning and shaping. The biomechanical cleaning and shaping greatly reduces the number of microorganisms. It is generally believed that instruments shape and irrigants clean the root canal system. Instrumentation of the root canal reduces the microbial content of the root canal to a great extent. However, the anatomical complexity of the root canal system is a challenge for this. In this slide, you can appreciate the complexity of root canal system. Every root canal system has spaces that cannot be cleaned mechanically. It may be practically difficult for any root canal instruments to reach these complexities. The only way we can clean these complexities like webs, fins, isthmuses, anastomosis, and other such intricacies is through the effective use of endodontic irrigation solutions. Now, let us discuss on the ideal requirements of an irrigant. An ideal endodontic irrigant must fulfill certain criteria. It should have a broad spectrum antimicrobial activity. You all may be knowing that endodontic infections are polymicrobial. So, if the irrigant is having a broad spectrum activity, it can act on more groups of microorganisms. Then it should aid in the thorough debridement of the root canal system. It should have the ability to dissolve the necrotic tissue or debris, that is, it should have a tissue dissolution property. It should also have low toxicity level, that is, it should be tissue tolerant and should not have any harmful effect on the healthy oral tissues. The other requirements are: it should be a good lubricant, that is, it should help in effective and smooth root canal instrumentation. It should have low surface tension so that it can easily flow into inaccessible areas of the root canal system. It should be able to prevent the formation of smear light during instrumentation or dissolve it once it is formed. It should be able to inactivate endotoxins produced by the pathogenic microorganisms residing within the root canal system. Now let's look on the functions of root canal irrigants. Irrigants perform both physical and biologic functions. The dental shavings formed during root canal instrumentation gets removed from root canals by the physical flushing action of irrigants. Thus, they do not get packed at the apex of the root canal, thereby prevent canal blockage and loss of working length. Root canal irrigants increase the efficiency of instruments. It is well known that root canal instruments do not work properly in a dry canal. Their efficacy increases by using wet canal only. Instruments are less likely to fracture when canals are lubricated with irrigants. Thus, it reduces the friction between the canal wall and instruments and makes instrumentation much easier and smoother. Irrigants act as solvents of necrotic tissue, so they loosen debris, pulp tissue, and microorganisms from irregular dental walls. Irrigants also help in removing debris from lateral and accessory canals where most of the root canal instruments cannot reach. Most irrigants are germicidal and also have antibacterial action. Irrigants also have bleaching action to lighten teeth discolored by trauma or extensive amalgam restoration. Irrigants help in opening of dental tubules by removing of smear layer. This helps in the penetration of intracanal medicaments as well as root canal sealers into the intratubular dentin, where microorganisms may be present. Coming to the classification of root canal irrigants, the root canal irrigants can be broadly classified into chemical agents and natural agents. Chemical agents are further subclassified into three. First one is tissue dissolving agents like sodium hypochlorite. Second group is antibacterial agents, which can be either bactericidal like chlorhexidine or bacteriostatic like MTAD. Third category is chelating agents, which can have either mild pH agents like HEBP, that is hydroxyethylidene bisphosphonate, or strong pH agents like EDTA. Natural agents include antibacterial agents like green tea, trifella, etc. Now let us discuss about the clinically useful root canal irrigants. First one is physiologic saline. 0.9% concentration is the commonly used irrigant in endodontics. Normal saline causes gross debridement and lubrication of root canals. It basically acts by flushing action. It is very biofriendly as there is no adverse reaction even if extruded periapically. Why? What is the reason for that? Because the osmotic pressure of normal saline is same as that of blood. But what are the disadvantages? There is absence of antimicrobial property. It is incapable of removing the smell layer, and it is also incapable of dissolution of the necrotic tissues. Next irrigant is hydrogen peroxide. It is a clear, odorless liquid. It is mainly the 3% concentration which is used as an irrigating solution. Coming to the mechanism of action of hydrogen peroxide, it is highly unstable and is easily decomposed by heat and light. It rapidly dissociates into water and nascent oxygen. The rapid release of nascent oxygen on contact with organic tissue results in an effervescence or bubbling action, which help in mechanical debridement by dislodging particles of necrotic tissue and dental debris and floating them to the surface. The nascent oxygen, when comes in contact with tissue enzymes like catalase and peroxidase, produces a transient bactericidal effect. It also causes oxidation of bacterial sulfidal group of enzymes and thus inhibits bacterial metabolism. There is a clinical relevance when you use hydrogen peroxide. That is, while using hydrogen peroxide in combination with sodium hypochlorite, always use sodium hypochlorite last because hydrogen peroxide can react with pulpy debris and blood to produce nascent oxygen gas, which builds up pressure on closing the access cavity. This can lead to severe postoperative pain. The next irrigant is sodium hypochlorite. Sodium hypochlorite was first introduced during the World War I by the chemist Henry Dakin for treating infected wounds. Hence, it is also known as Dakin solution. The original concentration suggested by Dakin was 0.5%, but concentration commonly used in clinical practice is 5.25% sodium hypochlorite. It is a strong reducing agent. It is a clear straw-colored solution containing about 5% of available chlorine. It is easily miscible with water and gets decomposed by light. Coming to the mechanism of action of sodium hypochlorite. Pecora et al. Reported that sodium hypochlorite exhibits a dynamic equilibrium as shown in the reaction. Sodium hypochlorite reacts with water to form sodium hydroxide and hypochlorous acid, which further splits into sodium ion, hydroxyl ion, hydrogen ion, and hypochlorite ion. At body temperature, the reactive chlorine exists in two forms, that is hypochlorous acid and hypochlorite ion, depending on the pH of the solution. Above pH of 7.6, it is mainly the hypochlorite ion, and below that pH, it is the hypochlorous acid that is prevalent. These two forms of reactive chlorine are responsible for the antimicrobial action. Destruction of bacteria takes place in two phases. First, penetration with the bacterial cell wall, and then chemical combination with the protoplasm of the bacterial cell and disruption of DNA synthesis. According to Estrella et al., sodium hypochlorite acts by following steps. First step is saponification reaction. Second step, amino acid neutralization reaction. And third step is chloramination reaction. In saponification reaction, sodium hydroxide, formed as a result of hydrolysis of sodium hypochlorite, acts as an organic and fat solvent, degrading fatty acids and transforming them into fatty acid salts, that is soap, and glycerol, that is alcohol, which reduces the surface tension of the solution. In second step, sodium hydroxide neutralizes amino acids, forming water and salt. With the exit of hydroxyl ions, there is a reduction of pH. The chloramination reaction between hypochlorous acid and the amidon group forms chloramines that interfere in cell metabolism. Chloramine has an antimicrobial action, inhibiting bacterial enzymes and leading to an irreversible oxidation of the sulfidal group of essential bacterial enzymes. Now let's discuss on some important properties of sodium hypochlorite. First is concentration. As already discussed, 0.5 to 5.25% sodium hypochlorite can be used as a root canal irrigant. The most effective concentration recommended is 5.25% sodium hypochlorite based on research studies. However, 2.5% sodium hypochlorite is a commonly employed concentration as it decreases the potential for toxicity. According to Todabinen et al., 1.3% sodium hypochlorite is beneficial as a working solution. Next property is tissue dissolution ability. Research studies have found that sodium hypochlorite completely dissolves an entire pulp in 20 minutes to about 2 hours. The pulp dissolving ability is useful during the cleaning and shaping of inaccessible areas such as isthmus region and C-shaped canal systems. The methods to increase the efficacy of sodium hypochlorite is by increasing the volume of irrigant, increasing the duration of irrigation, warming the irrigant. This can be done with the help of chair-side irrigant warming devices. And ultrasonic activation has been advocated to improve the effectiveness as well as enable the irrigant to reach into complex isthmuses of root canal. Coming to the drawbacks of sodium hypochlorite, the first and most important one is the sodium hypochlorite accident. It is the inadvertent extrusion of sodium hypochlorite into periodicular tissue, which causes cytotoxic and caustic effect on the healthy tissues. This is a true endodontic emergency condition. Then it does not remove the inorganic component of endodontic smear layer. It has an unpleasant taste, and the solution should be kept in a cool place away from the sunlight. Next irrigant is 17% EDTA. Nygaard and Osby in 1957 introduced EDTA in root canal therapy as a chelating agent. It is odorless, crystalline, and relatively non-toxic. It forms highly stable, soluble metal chelates in combination with heavy metals, and it has a pH of almost 8.3. Coming to the mechanism of action of EDTA, it inhibits growth of bacteria because EDTA chelates with the metallic ions which are needed for growth of microorganisms. EDTA has self-limiting action. It forms a stable bond with calcium and dissolves dentin, but when all chelating ions have reacted, an equilibrium is reached which prevents further dissolution. EDTA removes the inorganic part of the smear layer. Coming to the functions of EDTA, it has a dentin dissolving effect. It provides lubrication effect during root canal instrumentation. It holds debris in suspension. It helps in smear layer removal. It reduces the time necessary for root canal debridement. It aids in enlarging narrow or unobstructed canals. It helps bypass fragmented or separated instruments. EDTA is commercially available in different forms. Glide, it is a 15% EDTA and 10% urea peroxide. RC Prep, it is 15% EDTA, 10% urea peroxide and polyethylene glycol. REDTA contains EDTA and citramide. EDTA-T, it contains EDTA and texapone. Here EDTA is combined with sodium lauryl sulfate to reduce the surface tension and improve the penetrability. EDTA-C, it is a combination of EDTA and cetavolone. Cetavolone has disinfecting action. Next irrigant is 2% chlorhexidine digluconate. It is a cationic bisbiguanate. It shows optimal antimicrobial action between the pH of 5.5 and 7. 2% concentration is used as an endodontic irrigant. It is less toxic compared to most other root canal irrigants. Coming to the mechanism of action of chlorhexidine, the antibacterial action of chlorhexidine is related to its cationic bisbiguanate molecular structure. The cationic molecule is absorbed to the negatively charged cell membrane of microorganisms and causes leakage of intracellular components. At low concentration, it acts as a bacteriostatic, whereas at higher concentration, it acts as bactericidal. Chlorhexidine is a positively charged molecule that interacts with the negatively charged phosphate groups on microbial cell wall. It then enters the bacterial cell through some type of active or passive transport mechanism. Within the cell, chlorhexidine alters the cell's osmotic equilibrium. This in turn increases the permeability of the cell wall. Damage to the delicate cell membrane causes leakage of intracellular constituents, particularly adenosine triphosphate (ATP) and nucleic acids, leading to cell lysis. The advantages of chlorhexidine is that it possesses a broad spectrum antimicrobial activity against most common endodontic pathogens, including fungus. It is very effective against E. faecalis, which is considered to be one of the most common pathogens identified in failed root canal treated teeth. It has the property of substantivity, that is, residual effect, which helps in preventing bacterial colonization of the root canal for prolonged periods of time. It can significantly improve resin-dentin bone stability, which is beneficial when using resin-based obturation material. The disadvantage of chlorhexidine is that it lacks tissue-dissolving ability. It does not remove the smear layer, and its interaction with sodium hypochlorite produces a precipitate known as parachloroaniline, which is considered to be highly carcinogenic. Now let us discuss on some newer irrigants in the clinical endodontic application. First newer irrigant is MTAD. It was introduced by Toraminagent at the Loma Linda Dental School. It is a mixture of tetracycline isomer, an acid, and a detergent. MTAD is composed of tetracycline, which is a bacteriostatic broad-spectrum antibiotic. It has low pH, acts as a calcium chelator, and removes the smear layer. Next component is citric acid, which is bactericidal in nature and removes the smear layer. And it also contains detergent, that is 2N80, which decreases the surface tension. The purpose of MTAD is to disinfect the dentine, remove the smear layer, open the dental tubules, and allow the antimicrobial agents to penetrate the root canal system. The advantages of MTAD is that it removes the smear layer. It kills most significant bacterial strain, especially Enterococcus faecalis, which has been shown to be resistant to most irrigants and intracanal medications. It is biocompatible, and it has minimal effect on properties of teeth and has prolonged antibacterial effects. Next irrigant is electrochemically activated solution. The electrochemical treatment of tap water or low concentrated salt solutions results in synthesis of two types of solution. First is anodate produced in the anode chamber. Second is catholate, that is produced in the cathode chamber. Anode solution has been termed as superoxidized water or oxidative potential water. And research studies have shown that it can be used as a root canal irrigant as it is non-toxic to biological tissues and it is effective with wide range of antimicrobial spectra. Next is ozonated water. Ozonated water is a powerful antimicrobial agent against bacteria, fungi, protozoa, and viruses. Ozone has strong oxidizing power and destroys cell walls and cytoplasmic membranes of bacteria and fungi. Increased permeability leads to ingress of ozone, which causes microbial lysis. Next is Riddle solution. It is actually an experimental irrigant and is used to visualize the microanatomy of the root canal system in research study purposes. So Riddle solution can be helpful for improving diagnostic accuracy, treatment planning, and management of procedural accidents. It is mainly composed of 17% EDTA, 5% sodium hypochlorite, and HYPAC, which is an aqueous solution of iodide salts such as nitrisoate and sodium iodide. Next is photo-activated disinfection. It is a fast, effective, and minimally invasive technique to disinfect the root canal system. In this method, low-powered laser light is transmitted to the fiber optic tip to activate the photo-activated disinfectant antibacterial solution. Within 1 to 3 minutes, the photo-activated disinfection system eliminates more than 99.99% of bacteria found in the root canal system. So, to conclude, root canal irrigants are an integral part of clinical endodontics as they play an important role in the success of endodontic treatment. Great appreciation for patient listening. Thank you.